babies can be born with a droopy eyelid as well, and that typically happens when the muscle that helps elevate the eyelid, the levator muscle, is thick and fibrotic. It just didn't form correctly. If that happens and the droopy eyelid is impacting a child's opportunity to develop sight, we need to elevate the eyelid in a meaningful way. How we elevate the eyelid is really determined on how well that eyelid functions. If the eyelid functions pretty well, we can tighten the muscle that helps elevate the eyelid. That's called a levator aponeurosis advancement. And it's very similar to the surgery we do in adults, where we go in and find the muscle through an incision line in the natural crease of the upper eyelid, find the muscle and tighten the muscle with sutures. Now, if the muscle function doesn't function well and the eyelid needs additional strength to be elevated, we'll essentially tether the upper eyelid to the frontalis muscle, or the muscle that helps elevate the eyebrow. That's called a frontalis sling. Oftentimes, we'll use a silicone material that's placed in the eyelid and passed underneath the tissues through incision lines in the forehead to essentially tether the upper eyelid with the sling to the brow, so that a child can utilize their brow to lift the lid sufficiently to allow proper visual development. The decision tree between whether we choose tightening the muscle or we choose to use a frontalis sling is really dependent upon how well the muscle functions, and that can be determined in the office.